Let's flex the wrist forward. So now I've got relaxation
Okay,
here.
let's take a closer look at the right median nerve, but remember you have a left median nerve as well. Take a look at this anatomical front view of the body, the skeleton view, and you can see this yellow line right here. That's the course of the right median nerve. I want you to notice how it crosses this right wrist joint. It's going along the forearm there, crosses the elbow joint, the inside called medial part of your arm near where your bicep and your tricep meet, goes up into that pectoral slash collarbone known as brachial plexus region. That's just a gathering of nerves that come down from your cervical spine and they branch off and then they change different names and go different directions and have different sizes. But you need to keep in mind that I don't care where the nerve is or what name you give it, any issue along the path of that nerve can cause issues anywhere along the path of that nerve. Okay? It doesn't have to be isolated to where there's an issue with the nerve being able to slide and glide and move well between the tissues. And it comes up and you have it around here in the cervical spine. All of these areas can take a hit with inflammation and give you all different types of symptoms. So, what are some of the symptoms that you might have? Well, wrist and hand are a big one. Tingling and numbness in the fingers, otherwise known as carpal tunnel. So many people have carpal tunnel type symptoms and they need to get the median nerve taken care of, like right there along the pathway. But sometimes I've had people get that procedure and they still have pain. That's because there may be an issue with the nerve higher up. It's called a double crush. That's another way to say you're allowed to have more than one problem on more than one site where the nerve is irritated. Just because the hand hurts doesn't mean it's only coming from the hand. It can come from anywhere along the arm, in the neck, in the brachial plexus, come anywhere along there. So you have to check the whole pathway. I see many people feel better in the wrist when you take a look at the spine, and it goes the other way around. I have many people who have neck pain, and everybody goes after the neck, but what you can do is go down into the arm and go down into the forearm, work it like we're going to show you here, and those areas might feel better. And it's important to remember that you have a right median nerve, you have a left median nerve, and just because it hurts on the right doesn't mean that the issue is all on the right. You could have some stuff going on with the left median nerve as well. So I always recommend that you work both sides when you do these nerve glides because they always talk to each other. Okay? You can have shoulder pain, elbow pain, neck pain, I mean, you name it. All right? So we want to take a look at the whole course of this nerve here and then free it up on both sides. Choke points. Choke points are what I term where the nerve doesn't glide well, it gets stuck, there's inflammation, it's sticking in the fascia or the muscles around it, and you can cause inflammation, poor blood flow, because tight tissue does not accept blood flow well. Wrist is a big choke point. Forearm, medial arm, that's a huge one. The medial arm is one of my favorite places to work. You work the inside of that arm and you can find your whole body relaxes. Very, very powerful spot. The brachial plexus around the pec and collarbone, and of course in the neck as well. And this is when people always ask, well, how do you get these issues? And I'm going to be honest with you. I mean, you can get it from just about anything. Slips, falls on an outstretched hand, repetitive motions that you use the wrist a lot, particularly in what's called flexion, where it's bending forward. You can have it from neck trauma, where you get hit, poor posture, osteoarthritis. People get it in sports a lot where they'll get a zinger where you just get hit and impacted on the shoulder and it drives it in and you get trauma to the brachial plexus. You get tingling and numbness down inside of that arm. It happens when people have surgeries around the arm as well. I see it with women who've had breast surgeries from removal from cancer or lymph nodes or even had breast augmentation. Sometimes it can have that issue in there as well. So the point of this video is to just show you the course of the median nerve and have you work both sides, and I hope it helps you feel a little bit better. Please remember the golden rule that it doesn't take a lot to make a change in nerves. They're very sensitive in general, but if they're hot, which means they're inflamed, you have to go super duper uber easy. You might only need to be able to do like 3 to 5 repetitions on there before you have to give it a break. If something starts to make you feel worse, well, that's your signal that you just did too much and you have to do a little bit less next time. And as always, we encourage you to visit your individual healthcare practitioner for any individual guided advice. All right, with that, let's move right on into the video and see what we can do to help you feel a little bit better.
Okay, let's take a closer look at the right-sided median nerve. I'm going to use a piece of yellow exercise tubing to demonstrate the course of the nerve. It really helps with visualization. And actually, when I stretch this tube, it's actually going to be the approximate size of that median nerve. I mean, that's a big sucker. You've got one on the right, but remember, you also have one on the left, and they do communicate with each other. So one of the things that I'm going to teach you is that if you have issues with, say, your right-sided median nerve, you may find this more effective to do the left-sided median nerve first. That can make the right side a little bit more tolerable, right? So listen, I think it's a great idea to just do this on both sides in general. So let's take a closer look at the nerve. Remember, it's going to start at the cervical spine. So you can have issues with the nerve in the cervical spine itself, especially if you have any kind of trauma, like a whiplash type of thing, or you have poor head posture, all sorts of different things like that. It comes from the nerve roots in the cervical spine. It's going to come down and go into what they call the brachial plexus. Kind of, you see this knot here. It's almost like a plexus. It's a gathering of nerves that they're going to spread out, change names, change sizes. But this is the next station. It can get really tight in through here with what? Shoulder trauma, rounding of the shoulders, hunching, tight pecs, stuff that goes wrong or trauma to the collarbone itself, then you can get a brachial plexus thing. Some people who do sports can get a zinger right in through here. If they hit the shoulder from a fall, it affects the brachial plexus. You can have it go down. It comes down inside this arm like this. This is an area where it really gets trapped a ton, particularly close to the elbow joint. This one I see a lot. It courses its way down into the forearm region here, going down into the wrist. This is where people get a lot of that carpal tunnel type symptoms, and they get tingling and numbness and stuff and pain in the hand. So when there's an issue with the median nerve, you may experience symptoms in the fingers, wrist, hand, forearm, elbow, arm, shoulder, pec, neck, anywhere along that region. Now, this nerve, it can be a kink in one place that can cause pain throughout the whole thing. So we want to check the course of this nerve. One of the things that I like to use a lot is our Mojo vibration massage ball. So when you actually take this, you can place it on these areas, push in and vibrate, and you'll actually move the skin a little bit in the direction of the nerve. So let's say I'd start down here at the wrist. I turn the ball on, I place it right on the skin, I vibrate, and I go like this. Right? So what that's going to do is help that nerve start to glide in that direction. I'll move up into the forearm like this, coursing the nerve as it vibrates, going up to the elbow, move inside, just underneath that bicep region, massage there, come all the way up, go into the pec, underneath the collarbone, and go gently above the collarbone and a little bit onto the neck. Just be careful here. Do not push in really hard in this region. I don't want you to have any pain when you do this here. So I free up the tissue, vibrate the tissue with the Mojo vibration ball. Then we get into nerve tensioners or gliders, sliders, they're called. So let's show you how these work. Let's show you what a tensioner looks like. Look at the pathway of the nerve here and look at the tension in this band, right? Let's start at the wrist. If I flex my wrist forward, do you see how that creates slack in the band, that slacks the nerve, right? What if I extend the wrist? See how I extend the wrist? So if I extend the wrist, it tensions the nerve. So that's the first part of tensioning, is extending the wrist. Now this goes here. Let's take a look at this part of the nerve. What if I bring it closer to the body? So then it's a little bit more slack, right? What happens if I bring it away like this? There's a little bit more tension and my wrist is extended at the same time, right? Plus, I'm what? Opening up that pectoral brachial plexus region. Now let's talk about the shoulder here. If I elevate the shoulder, look what happens. I create a little slack here. If I depress the shoulder, then I create more tension from the neck and plexus into the shoulder. So I've already been wrist extension, arm abduction, moving away, extending back a little bit. The shoulder depresses down like this. So there's a lot of tension in here now. What about the neck? If I move the head closer to that arm, it gives slack. If I bend the head away, right, then it gets tension in that nerve. So you want to bend your head away from that side. Now, what about rotation? Okay. Turning your head can also change tension in the nerve. If I turn my head towards that side, I'm going to get a little bit more tension in that nerve because it's pulling the nerve this way, right? So that's optimal tension in the nerve. So I'm going to review that. Optimal tension is, I could do side bend, rotate towards, depress the shoulder, right? Extend the arm, abduct the arm, extend the wrist. That's optimal tension in the nerve. Now, this can be uncomfortable for a lot of people. You might not be able to do that. It might irritate the nerve. So then we go into what's called flossing. Flossing is where you're going to put tension on one end as you slacken the other, right? So let me show you probably the easiest way to do it. This is optimal tension. This is optimal tension. Let's flex the wrist forward. So now I've got relaxation here and I've got tension here. So the nerve is being pulled more this way. Does that make sense? So now we want to go the opposite way. So we simply reverse it. What we'll do is we will extend the wrist and then we'll side bend the head and rotate away. So now this has got slack and the nerve is being pulled that way. So what you're actually doing each time is this with the nerve. I became unhooked. This with the nerve. Does that make sense? So now, if we want to go the opposite way, I'll slacken the wrist. I'll go wrist flexion. I'll side bend and rotate towards. And then I'll just simply reverse it. Floss, 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 floss. That makes sense? So having that arm and wrist and head working in opposites. It's going to take you a little time, a little practice to get this down. You can do this seated. Some people like to do this lying down. You can do it standing. Just pay attention to how you feel. Remember the hard, fast rule that more isn't better, better is better. Then I want you to try the other side and see how that nerve feels on this side compared to the other side. And you may find, like we said before, doing one side helps the other because they're all interconnected. So give these a go. Let us know how it worked out. Thank you so much for watching. We'll see you soon on the next video. This is Dr. Perry from Stop Chasing Pain. See ya.